Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I want to talk to you a little bit about this morning is the airway. And a lot of times you think this doesn't have much bearing on our life or the way we live or other things, but it has a lot more effect on our development than we think. And so we have different things, these breathing apparatuses we use at night. It gives us a little more oxygen. It has effect on us. But one thing I want to really bring out is if we are mouth breathers, and there's a lot of people who are mouth breathers, and I'm one of them, and it makes a difference in the way you do the way your teeth come in. You cannot breathe through your mouth without breathing over the top of your tongue. I don't see any way you can do that. And if you do, if you're a chronic mouth breather, your tongue is in the bottom arch all the time while you're breathing, especially now if you close your mouth and breathe through your nose. You can put your tongue up in the palate where it should be, and it'll expand the palate. But down on the where your tongue is on the bottom, your lower arch will expand wider than your upper arch, and then you'll have to go from one side to the other, or you start chewing your cusp to cusp, but most people shift to one side and chew that way, and we see a lot of people that are doing that. Now, after you've done it a long time, your lower molars move out even with your upper molars, and they come together just one right on the other, and you bite your cheeks. And I have been worried with that most of my life, and I haven't gotten anything done about getting the airway open, but it's a real problem. I'm going to show you a few things here, and we'll try to run on through this as fast as we possibly can, and let's see what we have for you here. Let me get over and get our little marking pen going, and I'm going to just run through a whole bunch of slides of the skull, and we'll talk about the airway and everything. Now, this is just a basic picture of the skull. I'm going to try to get something here that I can draw on. Now, we know that if you breathe through your mouth, your tongue's got to be down in this portion of the mouth, and so you keep just a little opening in you, and your air will go over this way, but it doesn't press on the sides of these teeth here and doesn't bring them out, and so you develop cusp to cusp contact, which actually your cheek can get caught in that, and you bite your cheek, do that. I've worried with it all my life. You have to just keep your watching that you don't do this. Now, I'm going to move through these pretty fast. This just another showing you the upper teeth should be out over the lower teeth. In other words, your lower molars, let me just make a little white sheet here, and we'll just say this is our lower molars, and your upper molar should come down like this and come over and go up. Maybe this would be closer than that, but it goes on. Now that keeps your cheek, it holds your cheek out away from this. Now as your tongue is in the mouth down here, and this molar on this side too, and it presses against these molars, and moves them out. Now you would think that the teeth are so rigid and so tough and everything that the tongue won't spread them out, but it certainly will. And it'll push that out until this lower molar is fitting in there about like that. And the same thing over here, the upper and the lower molar will be bumping cusp to cusp. Excuse me. Now you can't chew good cusp to cusp. So many people will shift their lower jaw to one side or the other so that this will fit in like this, and the lower cusp is out that way, and that helps a little bit. You don't bite your cheek quite as bad in that respect, and it shifts the whole thing over to one side. And you watch people speaking, and it doesn't matter, they can be the top-notch lecturers in the world. You know, I've watched people, and frequently their bottom jaw is off to one side a little bit, and they may have had this same problem while they were growing up. Now, we've got allergies just stacked up here in the United States, and in many parts of the world they're worse than they are here. And this affects the turbinates and gets everything puffed up. I've got a bunch of slides here showing you these different things. But just remember, the tongue is supposed to be up into this part of the mouth when you swallow and when you are biting or talking. The tongue's going to be on the bottom, but it's just there for a short time. But when you close your mouth together and breathe through the upper, through your nose, the tongue will press out on these teeth up here, as same as it does down on the bottom, and more actually, and it will push the teeth out to where the molar relationship, the upper will, it'll be down and coming something like that. And it'll have this part that keeps the cheeks away from the contact point in here. But when it gets to where the contact points are right above one another, the cheek will get caught in there and you'll bite it and get a sore spot, and then it swells and you get it even worse. Now let's get on to a little more here, and you can see this skull of this person right here. This is you can't get these anymore. I got this one years ago when you could buy this, and it shows you the cortical bone, the cancellous bone, the nerves, and the lymph vessels and everything going to the teeth. It just is really detailed, and you can't get a plastic one that works like this. I wish they would free this up and let people have the actual skull. It tells so much more about this. Now this is where we want the air to come through, and we've got turbinates in here that we're going to show you in just a minute. And those turbinates do several different things to the air as you breathe it in. Now, if you breathe through your mouth, and I know this is a fact, your mouth will dry out in about 10 or 15 minutes or less, and it'll be dry all the way back, and you'll wake up in the morning with a seemingly sore throat, or it's irritated, and you drank some coffee or something that you lubricated again, and it settles down, and that's the way it, most of the time it happens. But your mouth dries out, but your body sends the moisture into the nasal cavity up here around these turbinates, and it keeps them lubricated and moist. And there's little fine hair on these turbinates, the cilia, and they get moist, and as dust comes in, they will catch this dust and then maintain it. And after a while, you may swallow, or you may get some of it off, and you can swallow it, and it goes in your stomach, and the acid kills the bacteria, most of it. But you can be in places that is so dusty that your system doesn't take care of it, and you'll get an infection, or you get whatever's floating around in that room. And this virus we've got nowadays is you can be into that, and wearing your mask helps take care of some of it, most of it. And it keeps you from giving it to others, and keeps you from catching it from others to a great extent. So I say wear them, and I would certainly say get vaccinated as much as you can. That helps. It reduces what damage you're going to receive from that. Now, look at the angle that these teeth are sitting here. If we have to intrude these teeth, these tend to flare out, so we have to tie these teeth back together in here, and it holds them in one place, but it tends to, if you open somebody's bite some, you're picking these teeth up and you're pushing these down, depends on whether your bottom or top teeth are the only ones, and that changes the way your facial structure meets here. That's something we need to talk about probably in another video. It gets involved here, and it'll take us too long to cover this. Now that's teeth fitting together, and you see this part right here keeps the cheek from sliding in underneath here and biting your cheek. Now the biting isn't the bad thing about mouth breathing. This is just showing cancellous bone and the way the nerve endings go in. Okay, here's what I wanted to get to, and this is just getting the camera right up into the opening, and you've got 3 turbinates. One of them is on the bottom part. The middle one is covers more, and this is the upper turbinate right here. Now this is the nasal septum, and a lot of times, well, mine is bent in here. I got bent playing ball or get something hit in the middle, and nasal septum be bent over, touching one side almost, and have a little more space on the other side. But one side of your nose, you can breathe better than you can on the other side when your nasal septum is there. Now, a lot of times the turbinates will get so large, and you fill them in with tissue, and these little cilia are growing off the turbinates, all just jillions of them. I don't know what a jillion is, but they're covered with these things. And as you bring this air through, these little moist hairs that are coming off these turbinates catch a great deal of the dust and the bacteria and whatever's floating in the air. I've been in a building one time, it just had a tin roof on the building, like you were hauling hay when we were kids, and even adults. And if you just had a tin roof, you had a nail hole in there, and the sun shining in through that nail hole, and you'll have a strip right down through the building where you are that'll look like it's almost a stick or something, but it's just dust that's in the air, and you can see it real plain that way. And you're in a place like that, your nose will get so much dirt in it, and bacteria and cow manure and a few other things that gets hung in there, and you may swallow a lot of it, and that your stomach takes care of it, or you can cough it up and spit it up, and it'll be just terribly dirty. You wonder how your body protects itself. Now, wearing a mask or something, if you had a moist mask, or if you're really getting serious about it, you can breathe through some charcoal, activated charcoal, which picks up poisonous things and things and incorporates them. Like you're a painter and you're in a room painting, there's dust in there that's full of the paint, and you suck it in your nose and it'll get down in your stomach and give you lots of trouble. So wear these deals that have filters on there that are full of activated charcoal, and they'll pick up all that, the big majority of that junk. But you're not doing that most of the time, and so your turbinates will get allergic to something like cedar. Starts, the spores come out into the air a lot of times, and you'll be allergic to these certain things, and certain people are, and your turbinates will swell up, and when they swell up, they tend to close the airway here, and so now you can't breathe good, so you drop the mouth open and you breathe through your mouth. Now your mouth will dry out, and this junk that you're breathing will go on down in your lungs. Now, if you are running or doing some vigorous exercise, you have to breathe through your mouth to get as much oxygen in your body as you possibly can. So you suck in a lot of junk when you're running with your mouth open. It would be good if you had a moist handkerchief or something over your mouth, and you breathe through that and cut some of the circulation down. But your nose is the best place to breathe through by far, and it filters this air coming into your nose. It filters it. It moistens the air up to body, the amount is in your body, and the nose doesn't dry out anywhere like the mouth dries out, and you can still breathe, and it's moist. It comes in, it goes, it heats the air up to body temperature. It filters the air as it comes in. It blocks the stuff off, of course, and you swallow it or get rid of it in other ways. And it works kind of like a carburetor, where you have to suck in a little bit to give the air speed enough it goes down into your lungs. Now, if you're just sitting somewhere and you're breathing through your mouth, you don't get that. In other words, your air just goes slowly down and gets into your lungs, but it doesn't drive it out into the little alveoli and everything in the lungs, where there's a good exchange of carbon dioxide and air and oxygen down in the lungs. In other words, if you're breathing through your nose, you will get a higher blood oxygen than you do if you breathe through your mouth. And that makes a difference. It makes a difference in if you've got a child that's wetting the bed, don't jump on the kid and fuss at him and everything. If you get him breathing through his nose, many of these will stop wetting the bed when they do that. It just cuts down the urine that you're giving off in the bed. And I know that because I have a problem with that. If I breathe through a CPAP, and filters the air, it also moistens the air, it does all this, and you breathe through your nose when you're breathing with that. I have to get up to urinate much less, maybe once or twice during the night, but if I don't, sometimes it'll be 4 or 5 times that you have to get up. So it works on adults just like children. If you're having to breathe through your mouth, you will actually urinate more than you do if you breathe through your nose. I don't know about the volume of it or whatever is on that, but I know that's true. And if I can breathe through this CPAC and moisten and keep that oxygen level in your body up, I won't have to get up and go to the restroom near as often as I do the otherwise. Now, you can believe that or not, you can try it. It seems to work on me. But don't try to get your child to quit wetting the bed until you have found out if he has enough area in the airway to breathe. And don't take him to an ENT guy and he comes in there and sprays the nose out with something that shrinks all this tissue up in there and then checks his breathing and he breathes good. So he tells you there's nothing wrong with his breathing, he's fine. There is something wrong. He doesn't spray his mouth out. And if you spray your nose with certain things that shrink the turbinates and shrink the tissue up there, and you get allergic to that thing that you're using, you have to be very careful. That tissue will really swell up then, and you can't breathe through the nose at all. It'll just stop up. It's good if you take water, just plain distilled water, and add a certain amount of salt. You can buy these little things that give you a certain amount of salt for a certain amount of distilled water that you've got, and you can mix that up and squirt it up in your nose, and it'll go all around in there, in both sides, and go back and forth with it, and you can wash the turbinates off, and you can wash the cilia, and you can spit out a lot of these things that are floating around in the air. Now, here I live in this little town of Glenrose, and we have cedar trees all around here. Sometimes in the fall you'll see a wind blow through those cedar trees, and there will be a kind of a reddish brown dust, looks like just come out of those cedar trees. It's the breeding of the cedar trees that catches and breeds that. And that cedar frequently is what's really got some people allergic like that. So that's, if you can breathe through your nose and catch it and spit it out without it messing up your nose, you'd have to rinse them off real good. Now, these are some of the things that happen to us, everybody. And if you lived in a town where there's this loaded dust and gases that come off of automobiles that aren't properly fixed for their work, and to cut out the pollutions that get in the air, you may have a lot more trouble than somebody that's out in the country. But then in the country, you got all these trees and things that are budding, and you're allergic to that. I'm allergic to dust, just fine dust, dog hair, and things like that. You can go in and they'll stick things in your arm and have all these things that you might be allergic to. If they're swelled up and got little raised bumps in there, then that thing, they know which one it is. It's bacteria out of the dog's hair, you know, that this things that are, you would think, not think, or cats or different animals, or I had one doctor, he wouldn't mess with your allergies at all until you quit sleeping on a pillow that was filled with down or feathers that had been cut. The people that were allergic to feathers, things of that nature. Let's get on here. We've got a lot to cover, and I don't want to take too much time, but these are the turbinates and the nasal septum in there, and that's another view of them. And this is a kind of a view from another angle that you can see these turbinates that can be loaded with these cilia that stay moist, and they collect this stuff. Now, I had a little boy once that was a patient of mine, and his mother was taking him to a lung specialist, and they were doing things to help his lungs and everything. Then we found out that the little boy had breathed through his mouth, and his lower jaw was too wide, and so we widened his upper jaw out. We separated the palate, and you move this out, and you've got to separate it and move the roots of the teeth out with the palatal separator. If you just put one of these things in, it's got a bar, a lot of times the tooth will go out like this. You know, you want the tooth to go out and spread the roots further, and you can expand the upper arch like this and get people to breathe. And we did that, young man, and we got him breathing. We opened the airway up, and he had better airway, and he breathed through his nose, and what do you know, his lung problem went away. In other words, he was sucking in stuff through his mouth that was giving him so much trouble that they were having to take him to the doctor to see what was wrong with him about the lungs. And you can be in so much dust sometimes that it'll make you sick, actually. That's especially where you're showing cows and things in our agricultural rounding, and they're washing these cows and blowing them off with dust, air, you know, and all the air is just full of crap. And you're sucking it in your lungs. And my son, we had cattle and everything, would get sick. Every time he would come home and have a spell there for several days, he was sick from breathing this crap into his, getting into his body. You'd get so much in there, your body couldn't take care of it. So that's one of the problems. All right, here is looking at it from a different angle. This is nasal septum. The turbinates up here, and 3 turbinates. Now, frequently, some people, and I think I should do that, they go in and they'll reduce a turbinate. They can pinch it off here and freeze it, and then part of it will just peel off. They can take part of the turbinate out. One of the best ladies working for me couldn't breathe good, and we had a ENT guy that came and lectured with us, and she went in and finally got him to reduce the turbinates in there, and then you had more space where the turbinates could swell up or whatever it is, and she stopped having this problem with that. Now, if you take somebody who's having a lot of problems and you come in here and you widen this out with a palatal separator and you spread the teeth out, and we band those teeth where they're absolutely rigid, and as it goes apart it doesn't do this. That does that with these bars. So if you see somebody separating their mouth with a bar on each side, it's not near as efficient. It just tends to do this. Sometimes your roots come together and the crowns go out like this, and that's not what we want. We want the roots going out this way, and you develop or you just restore the airway that has been affected by mouth breathing. And if you get it out there where you've got more airway, the person can breathe better, even if they get in some allergy area and their turbinates swell. If the hole is big enough in here, they can still swell up and you can still breathe through that. And so it makes a tremendous amount of difference to spread somebody's palate out. It doesn't have enough airway in here. And we found out by putting pressure on the anterior teeth out here, or now you could put tads up here in the cortical bone and push out in the front, and these palatal separators that have the separating device back in the back where the molars are, it pushes that part out, but you need something in the front. I went up to the guy that wrote the book on palatal separation from England, Donald Timms, and I said, how old can you separate the palate on a person? And he said, oh, about 17 or 18. And I didn't stand there with a lot of people around him. I just left because we had been putting pressure between the central teeth, and we had separated the palate on 30-year-old people and even a few 40-year-old people. And we've separated it also on people that we couldn't pull the sutures apart, but we just kept putting pressure gradually, and the bone stretches, but the sutures don't come out. I've had that happen. We can widen the palate of an older person in that fashion. And you've got to put this buccal root torque. If you widen it out with the large arch wire, you've got to put the tip in the arch wire going back to the back. It'll cause the roots to go with the crown as you go out. It doesn't do this. It goes. If you just put a large Big Daddy arch wire in here, it doesn't have any torque to it, and it'll do like this. And the root tips will go closer together. So you've got to put a rectangular wire there, and you bend it like this at the end, your progressive torque. It'll go out like that. Then you've got to spring that in and put it into the grooves of your whatever bracket you're using, and this will tend to do this to the tooth. In other words, it's trying to do this. Now, if you don't put something strong on the outside, like a large wire that we use, and you just put an arch wire in there with a lot of root torque in them to bring the roots out and leave it and nothing else, the torque is more powerful than the expansion of your arch wire, and it'll move the crowns of the teeth in instead of the roots out. The crowns are down here in the air, and you have to put something to bring them out. It's more powerful than the torquing, and it'll bring the tooth and the root out like that. And that's what we want to insist, that if you mess with these Big Daddy arch wires, and you do a lot of expansion with them, then you need to put this root torque. And that gets you the airway, and the airway can be so big and free in there that you can have your turbinates swell up a little bit, and it doesn't bother your breathing. You can still breathe in there. So this is just some things I wanted to add about mouth breathing problems that people have, and they don't think about this, and it's not right. I'm going to erase this now, and we'll go ahead. I'll try to get to another. That's a messed up. All right, this is just where the suture separates when you separate the palate, and where it separates, I don't know. It's just the weakest spot in there. But you got force back here in the back of the mouth. You need to put some force up here in the front of the mouth. That's where the most bone is, right in there, and that's moving that apart. So we have been expanding adults into their 30s and 40s. Some of them, you can try it, and if you put it in there and just stay there with a little force, actually, we've got one guy, I had one guy that's 312 pounds, and we couldn't separate the sutures, but he didn't mind the pressure, and we just kept on till we spread his palate out till it went over the lower arch down here. The bone just stretched in there, and it thins out, but it thickens back up again. So it's possible to do that. All right, let's get over here. I think I've got a little bit more to show you. All right, this is when we separate the palate. The gadget sitting right in here is what you screw apart, and you'll have a wire coming on these teeth right in here, and it's soldered. It comes off of here and here, and it's soldered onto this, and we put that on bands. Insist on banding the teeth here. Don't just put a bar up here. It doesn't grab the teeth and push the roots out. And so we band these teeth. I was down in Mexico and talking to a lady. She brought her son in and said they had tried 3 times to get a separator in there, and the thing came out every time. And I was talking to her like she was a housewife, and the lady was I think head of the orthodontic department in one of the schools down there. And I said, lady, I never have had a palatal separator come out until you got ready to take it out. And the secret of it is you band these teeth really good, and you take an impression of it, and then you take your impression out and put the bands back into the impression as accurately as you possibly can. And then you build the separator in here where we will separate it, and some of them I separate them, it looks like a ½ inch in there. We'll separate somebody. Now here's the most bone structure, and here is the palate up here. You're pushing apart from here, you're pushing this, and you've got the most stuff you're trying to separate is out here. Now, I haven't tried this, but I think you should come in here and put a screw in here with the head of this screw, and put a sliding arch in there, and put a tremendous amount of pressure on the bone structure rather than the teeth themselves. However, it works by just putting a bracket on the teeth, and there was a sliding arch up there, and you put a spring, just a coil spring in there as tight as you can get it, and you've got it going apart here, and you've got it going apart here, and then pushes this apart, and we've been able to separate people into their 30s and 40s, and I've done this for years now, and I think I can tell you that it works, and you need to try it. Now, the secret of having this thing come out, and this lady said she had me take the thing off that she had brought her son in there with, and we built one and put it on there. You seat your palatal separator, just push it up in there as far as you can get it, and don't mess with it for about a week. And you push it, and if the child has a problem, push the thing in like that until you get it up. I've never had one fall out from just being shoved in there. But what it does, it works that tooth over for about a week, and it makes it to where you can seat this palatal separator up where it really ought to go, because you can't pull these bands off and put them back in the impression and pour it up and be absolutely accurate. But if you put the palatal separator, you make it, seat it, let it stay for a week or 10 days even, and it's going to smell when it comes out. You got to flush it and really wash the teeth and clean them up, and clean the palatal separator up. But when you cement it, you can cement it all the way, and there'll be cement coming out around the lingual part of the band right in there. You can cement it all the way. I've never had one come out that we submitted until we got ready. We have to work to pull it out. In other words, a lot of times we cut them off here and then pop those bands off and take them out. Sometimes I don't band up above. We just get the motor and put a bar here, but it really would be better if you had a band on this tooth right here, because it won't go apart quite as good. Now that's, I think, is a wisdom tooth on this case. Now I hope that you'll see that. I think a palatal separator is one of the best things that we can do for people. And there's so many people nowadays that live in cities that are just crammed with businesses and manufacturing things, and there's so much crud in the air, and they are allergic, and they breathe through their mouths, and it carries all that crap down into their lungs, and we die younger than we should have been. London was so bad, people could hardly live in the place at one time. And it's important for us to clean up the air, and I think that's a good thing that's being done now to some extent in most of these manufacturing areas like that. And we separate the palate, and you can see that. And I'm going to run on here just now. Here's another view of the turbinates. You see the line in here like that, and this is a piece of the palatal, the nasal septum. Okay. And we've all got this. I mean, we come into this world with this thing. We have problems right in here. I tried to cover the other day. And we have learned where the problem is. And we take this and make sure you advance the mandible. I've had no problem. I've never seen anybody come into me with a problem there that they bit down and their jaw slid forward. In other words, the condyle moved over here, and where it's got forced back into the back and pressing that retrodiscal tissue. It's highly vascular. That thing gets inflected and gets swollen up in here, and you will have a fit with it, and you can't, if you don't do anything about it, the pain will be all over your shoulders, neck, and everything, where around your headaches. And the same thing is true about vocal cords. They give you the same pain situation as temporal mandibular joint deals. Of course, you can have an earache, you can have something wrong with that, and then that'll affect this. This will affect the ears too. So I'll put that in on this part here. And thank you for watching this. I hope that wherever you are, I have no earthly idea who I'm talking to, and I hope that what I say is correct. I have tried all of these things, and I've gotten them to work, and I was able to get rid of all the pain coming from this joint right here, but not the clicking. You know, the clicking is coming from a disc being off in front, and as you open up the mouth, that ligament gets real tight, and it jerks that disc back up on the head of the condyle, and it'll go, you know, like you can hear somebody eating at the table sometimes that's got that problem, and they'll usually have other problems with it. All right, there's so much going on in here, but just believe me, you need to breathe through your nose if you possibly can. You take care of the air. You're like a carburetor. You moisten it, you filter it, and you suck it in at a certain speed. And when it sucks in and it's traveling fast, the air goes down in the lungs and goes out in the alveoli, and you've got a better exchange of carbon dioxide and oxygen, and the person will have a higher blood oxygen than somebody that's breathing through their mouth. And that's just normal. If you're just sitting down, breathing through your mouth. Now, when you're running and exercising, you're sucking it in fast, and you're getting a lot of crud in there too. But that's what you risk when you run. Is whatever the air is, you're getting a load of it in your lungs too. So I'm gonna hush up, and I better cut this down. But thanks for watching. I don't know who you are, or where you are. I'm just interested in you doing super good orthodontics. And orthodontics includes TMJ work, and the person that's written all these articles about orthodontics having nothing to do with the TMJ that is so ridiculously wrong that I can't. It just eats me up that you can get a TMJ problem from just making. I seen a kid one time to have a crown put on, and they didn't want to grind the back side of the crown off, so they just made a thick back to it, put it in, until the kid came back. He was chewing, and his bottom teeth were hitting the back of that before he got close, and these teeth got sore, and so he went around pulling his jaw back so he could eat, and he pushed the condyle back into the retrodiscal tissue, and he had a TMJ problem, and people get that, and the people that are doing it and causing it have no idea what's causing it. And that's something we ought to insist on people that are going to work on the teeth. I don't care what you're doing to them. You ought to understand what happens back in here. I've had, I don't know how many people that have had orthodontics, and then they got TMJ problem after it, and they went to this speaker, and he just said, orthodontics causes TMJ problems. Well, that's a big lie. It doesn't. Orthodontics, but the kind of orthodontics he was doing and the retention caused the TMJ problem. So I better shut up and close out here. But thanks for watching, and I hope that everybody anywhere that's working on teeth, don't think you don't mess with this part right back here. I go to the dentist, and a lot of them don't have any foggy idea what is taking place back there. And what you do on these crown teeth up here has an effect on that many times. So I better shut up, and I'll hope that you'll come back again, and I want you to join our group and subscribe to it. It's amazing, this YouTube and stuff, being able to reach out all over the world to whoever can listen to it. And I want to make sure what I tell you is good. I don't get a red cent out of any of this, but I hope that everything I tell you will be good, but there'll be something that we'll work on. It won't be right all from now on, but a lot of it will be. So I'm going to say goodbye and check back with you later on, and we'll come back with something else.